Joining us now is Tyler. He is a pharmacist from Virginia. Hey, Tyler, and thanks for joining us in this conversation today.
Hey, how's it going?
I'm
Thank you for
doing
having
well.
me.
Thank you for being here. Okay, so for our viewers who may not know you, can you tell us a little bit about your background?
Sure. So I am Tyler from Virginia. I'm a clinical pharmacist at one of the friendly hospitals near you. I also have a little bit of experience in the retail setting in regards to pharmacy, but as of right now, I'm in one of the hospitals.
Awesome, awesome. So, as I'm sure you're aware, as the coronavirus pandemic raises and the stress and anxiety levels for Americans are at a high, how have pharmacists taken precautions to reduce the interactions between customers and doctors without compromising services?
So it really just depends on what setting you're talking about. So a lot of different pharmacists work in a lot of different settings, and depending on that settings, kind of what they do in that regards. With that being said, a lot of things are being rolled out with the CDC in regards to protocols, trying to give us a little bit more guidance in regards to how we go about that. Recently, one of the things that's been a big kind of back and forth is the use of face masks and things of that sort. But just from a general standpoint, from the retail setting, so this would include like your Walgreens, your CVSs, and things like that. They're really promoting the hand washing thing, as well as trying to get us a little bit of a protective equipment, so your masks and things of that sort, gloves in certain situations. But for the most part, it's not too heavy in that regards, as far as I know. In the hospital, we're pretty much on high alert in regards to that as well. Obviously, it's a little bit more tailored to the ones in higher risk situations. So, in the emergency department, is this a COVID patient or is this a patient that has a risk of being COVID positive? They're trying to take more of the precautions with the face mask, the gloves, the gear, the clothes, the gowns, and everything in that regards. And everyone else with a little bit more of the primary type stuff, like just the face masks and stuff like that.
How are pharmacists handling the rush to fill everyday prescriptions while people are still sheltering in place? And have you noticed a spike in the need to fill prescriptions due to this pandemic?
So pharmacists are basically kind of like everybody else. We're doing the best we can with what we have. To answer your second question, I always like to kind of give people a picture in regards to what it's kind of like to work in a retail setting specifically.
Okay.
And first of the month, the first day or the first couple of days of the month, that's usually one of our busier times because if you have a 30-day supply of a medication, you're going to need to have that refill. And
Mm,
so, of course, if you're running out of it at a certain time, 9 times out of 10, somebody else also needs theirs filled. So we always like to joke about that particular rush,
hmm.
especially on the new calendar year,
Oh
because
boy.
there's insurance that plays a role in that. Some drugs aren't covered this year, and there's a lot of different things that we joke about that.
Mm,
But even also considering things like weather. So if there's going to be a snowstorm or a hurricane or rain, you always have a flux of people.
wow.
Just to kind of keep that in mind, I think with this pandemic, it's like that times 10. So
Wow.
it can be very stressful.
Wow. That sounds very alarming. So let's shift gears and talk a little bit about drugs from a pharmacy perspective. Should the American public stop taking NSAIDs due to the ability for it to mask certain symptoms when it comes to COVID?
So there's a lot to unpack with that particular question. The the easiest way I know how to answer that is to say that there's still a lot of research being done in that regard. So I can't definitively say you should do X or you should do Y or you
Okay.
should do Z. But with that being said, there's a lot of research that is coming out that is suggesting a lot of things. And so a lot of people aren't familiar with the research and the background that goes into a lot of medications or the studying of it and things of that sort. And so usually the process is a long
Yep.
extended timeline in regards to where we're making sure that this drug is, number one, is it safe, and
Hmm.
number two, is it efficacious, or if is it effective doing what we think that it should be doing. And there are plenty of examples in history where some people have had this particular drug and they think that it's going to do one thing or be effective with this sort of thing, and it's completely different.
Okay.
Same way in regards to their adverse effects. So I'm sorry I can't give you a direct answer as in yes, you should be doing this or you should not be doing this. But a lot of research is being done to kind of unpack that particular question.
Okay.
As
That's
of right
understandable.
as of right now, I'm not familiar with any specific guidelines that have definitively proven that you should avoid ibuprofen or NSAIDs for, this particular reason. I can tell you though that the reason why that has come out is that there have been similar types of infectious diseases or viral diseases where NSAIDs have been able to kind of prevent the body's ability to get rid of the virus to a certain extent. And I'm paraphrasing here, and I'm sure my doctor friends will be a lot better in describing this. But because there are some similarities between that and this particular one, NSAIDs and steroids and stuff like that, they are kind of recommending that you kind of avoid it unless provided by a doctor, you have a specific reason. So like I said, it's still a little bit of a gray area, so I can't confirm either to do or not to do, but that's kind of where a little bit of it's coming from.
What do you think of the medications from a pharmacist's perspective in regards to COVID-19?
So there's a couple things with that. There's a lot of research and a lot of time and a lot of dedication being done right now in regards to trying to find an effective medication specifically to treat that. And like I've touched on before, there are a lot of different people who are specialized in this area, running the clinical trials, making sure they have enough people and things of that sort. So there's a lot of different things. Obviously, hydroxychloroquine is at the forefront as of right now. CDC has guidelines for that in regards to its use to make sure that it's used in appropriate people in the appropriate situation.
Okay.
Um, with that being said, a lot of people have concern with it because it's not FDA approved, but there is what's called off-label use, which is actually pretty commonly used with doctors throughout history. There's actually a lot of different medications
Hmm.
that are used right now that you wouldn't think that are FDA approved, but is commonly used for that. So I think everybody can just kind of wait until we get a little bit more data out, and as the guidelines come out, we can follow that and do that appropriately.
Okay. So, lastly, the American people need hope that this pandemic will blow over. What words of encouragement or advice would you tell them to ease some of their anxiety or fears from a pharmacist's perspective?
So from a pharmacist perspective, there are a lot of different things that we are unsure about, but there are a couple things that we are very confident in, and that is that we have a very good group of people that are dedicated to doing whatever they need to in order to take care of you. These are our doctors, our nurses, our respiratory therapists, all the other people, and all the other networks that are coming together to do this. So there is some comfort and hope in that. There is some also comfort and hope in that there's also a dedicated group of people that are putting in a lot of hours to make sure that we come up with the answers that we need. So I'm sure that it's only a matter of time before we get everything that we need and we deal with this appropriately.
Well said, well said. Well, Tyler, thank you so much for taking the time out to, join in this conversation.
Thank you for having me.